So let's talk about grandfathering, non-grandfathering, and what that looks like, okay?
Sure.
I mean, there's other things we can debate all day, and, you know, I'm going to tell you Blue Cross is perceiving you've lost it. You know, unless somebody comes back, I'm not going to be able to change or overturn what legal is saying on that, and you know, I can get you to some legal counsel, but they're going to tell you the same thing. For right now,
Yours is.
Mine is.
That's correct.
And our outside legal counsel that we use, okay? Not only ours, but we also have taken this outside beyond Walmart, Blue Cross Blue Shield for an interpretation on this. So let's talk about grandfathering versus non-grandfathering. Let's look at what happens there. In a non-grandfathered situation, again, this is all in the health care reform law. Actually, January 1st, if we get through all this and it's determined, yes, you're non-grandfathered, January 1st, there will be benefits paid on your group that currently, or there will be benefits paid on your group differently than what they're paid today. Preventative services. Right now, if somebody goes to the doctor's office, have preventative services, or even preventative service at a hospital level, they pay the appropriate copay, and then or they pay the appropriate co-insurance. Deductibles being waived on those services today, but they pay a copay or a co-insurance. Under healthcare reform, January 1st, somebody going in for preventative services, that's covered at 100% by the insurance company. The
Okay,
employee,
so that was part of my...
right. The employee would not have any cost share in that, in copay or co-insurance. So that's one thing that would change. Another thing that would change, if you're non-grandfathered, is smoking cessations, both counseling and any smoking cessation drugs, prescription drugs, covered under this plan. Currently, you do not have coverage for that. So those are two benefits that are added up front. There's some other benefits that are changing, but it has no impact of whether you're grandfathered or non-grandfathered. I mean, it's going in regardless of whether you're grandfathered or non-grandfathered. Those benefits are, and some of them have already gone in, the dependent to age 26. That's already on your policy. Again, that to age 26, it says whether they're married or not married, whether they live with you or do not live with you, they're eligible to be covered under a member's plan if the member so chooses. Pre-existing conditions, again, that went in October 1st. Anybody coming onto your plan, there's a 12-month waiting period for pre-existing conditions. If they have not had credible health insurance coverage with less than a 63-day breaking coverage, then that went on for the whole family. So if somebody came in with no insurance, they've not had insurance for 63 days or longer than 63-day break, they had a 12-month waiting period for pre-existing conditions. Or if they chose not to enroll and they come later, there actually was an 18-month waiting period for pre-existing conditions if they're coming as a late enrollee if they did not have credible coverage. Those children under age 19, there are no longer any pre-existing conditions regardless. So those have all been eliminated. Again, it doesn't make any difference if you're grandfathered or non-grandfathered. The lifetime maximum limit, you've got a $5 million lifetime max on each member on your policy. January 1st, that's being removed regardless. So that's...
It's unlimited?
It's
then?
unlimited.
It is.
It's unlimited, yes. And then it's just something about essential benefits. You can have annual cap. You don't. It's just unlimited benefits as of January 1st. So on your group plan, because you're part of a small group, that doesn't even pertain to you. We've talked about the preventative services. A big thing is non-discrimination. If you're grandfathered, you can discriminate. If you're non-grandfathered, you cannot discriminate. What that means is, let's say your elected officials, you pay 100% of their premium. Everybody else you don't. Okay, that's the discrimination. Now I know you do something different because of tenure. That's okay. You can do something different of tenure, But you can't treat different classes of people differently.
Which we don't.
Which you don't, which I knew you did. I did know you had the tenure thing, and that's not an issue, okay? You still pass discrimination testing. Minimum loss ratios, that's to insurance companies. We've got to pay at least 80% of our premium back in premium dollars. That doesn't pertain to you, that's on Blue Cross Blue Shield. Emergency services, we treat that the same now as we do any other services. So those things really are not pertinent. We get into primary care, those are for our H&O type plans, so they're really non-issue things.